This show is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice. The content on this show is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they have, and they should seek the assistance of their healthcare professionals for any such condition.
This is Rooted in Healing with Dr. Beth Claxton, exploring the science of functional medicine and the power of healing from within. Breathe in. Breathe out. And now your host, Dr. Beth Claxton.
Welcome to Rooted in Healing. I'm your host, Dr. Beth Claxton. I'm a medical doctor, board certified in obstetrics and gynecology, and certified in functional medicine through the Institute for Functional Medicine. I wanted to put this show together for quite a while because there's so many options out there for healing that don't fall under the traditional umbrellas and are definitely not covered by traditional health insurance plans. And I'm scouring and looking and discovering these amazing modalities that everybody needs to know about where true healing really can happen. Today we have a guest, Greg Blommel, who is an internal medicine physician in Wisconsin, who is certified in lifestyle medicine, and he works with just the nuts and bolts that we used to live by and used to keep us healthy until the Industrial Revolution and the era of antibiotics and when we all became sedentary and all these medications were developed. And with that, let's go to a commercial break, and we will be back for Greg's interview in just a moment.
For more information on Dr. Beth Claxton, visit bethclaxtonmd.com. And now, more Rooted in Healing with Dr. Beth Claxton.
Welcome back to Rooted in Healing. This is Beth Claxton, your host. I'm a medical doctor and board certified in obstetrics and gynecology and certified in functional medicine through the Institute for Functional Medicine. And I'm so glad that you're here with us today. I have a really special guest today, a friend that I met last fall, and we really connected. And when providers connect, when doctors connect on all things holistic, it's almost like magic. So I'm introducing Greg Blommel today. Greg has been practicing for 30 years as a board-certified internal medicine doctor. He trained at the Medical College of Wisconsin near Milwaukee, and along the way he held various leadership roles, including chief medical officer, health system board member, president of their clinic prior to the merger with a medical college. And he's been a change agent and leader in quality, and specifically in helping setting standards for health systems across Wisconsin as a member of the Wisconsin Collaborative on Healthcare Quality, which he chaired the Committee on Metrics. He has been practicing lifestyle medicine since 2020 and holds free monthly meetings to his patients to promote the 6 pillars of lifestyle medicine. He is 90% plant-based in his diet, sugar-free and gluten-free. He's trained 2 nurse practitioners to work with him and his patients, and he is proud of the work they do. Outside work, he swims competitively with U.S. Masters Swimming, and he gardens and enjoys outdoor activities. Welcome, Greg.
Thanks, Beth.
So glad you could join us today.
I'm very happy to be here.
Can you tell us, there's so much that I want to talk about, so I'm going to jump right in. Can you tell us about the American College of Lifestyle Medicine, and why did you become interested in being certified as a diplomat?
Thanks, Beth, and I really appreciate your introductory comments about how connection really is something that is, to be revered in a sense. when I started this pathway in 2019, basically I'm the only provider in the area that in our clinic that went down this direction. Mm-hmm. Lifestyle medicine is a medical specialty founded in 2004 by John Kelly, Wayne Deisinger, and Hans Diehl, and currently has roughly 20,000 members, is my understanding. It uses a therapeutic lifestyle interventions as a primary modality to treat chronic conditions, which includes, of course, cardiovascular disease, diabetes, obesity, and many others. The lifestyle medicine certification came about in 2017 and endeavored to help clinicians apply these lifestyle evidence-based approaches. So we think of it almost like a prescription and try to cover what we refer to as 6 lifestyle or 6 pillars of lifestyle medicine. Mm-hmm. And that includes a whole food, plant predominant eating pattern, mm-hmm. physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connections. Mm-hmm. So we operate under an understanding that, like medications, lifestyle medicine prescriptions can be dosed. And there's this concept of, for some patients, putting together an intensive lifestyle medicine prescription to try to reverse and really address the multiple conditions.
That's great. That's the basis of what we learn in functional medicine. Those are the hallmarks. And when I ask you about a whole food, plant predominant eating pattern, I think when people hear this, they think that someone's asking them to go vegan.
Yeah, I think that's right. And the first question is always, where do you get your protein? Mm-hmm. Right. So, the approach to this, and maybe we can talk about it a little bit more in as much detail as you want, really has to do with meeting people, where they're at, mm-hmm. and understanding, what their starting point is. But to a huge degree, whole food plant-based implies avoiding essentially processed foods, mm-hmm. and with a big focus on sugar, especially liquid forms of sugar like fructose, soda, fruit juices. And then to be able to incorporate the rainbow, as we talk about, the phytochemicals that are involved with these pigments in plants have healing properties. And mm-hmm. so we try to, really begin to, through examples in our conversations, to replace foods that are in their current diet, mm-hmm. with foods that we want them to move towards. The idea of less meat is one in which I don't want to ruin the whole conversation that I have with somebody by saying this is all about not eating meat.
Right.
It's really much deeper than that. So mm-hmm. I tend to be less of that point in the early conversations with people.
Mm-hmm. Because it's more about eating more whole foods, more
It
plants,
really is.
More
right.
whole grains. And
as one American College of Lifestyle Medicine lecturer said one time, think of it as intact cell walls. Mm-hmm. I mean, I guess from the standpoint of, the attendees, we understand what that means. You have a plant cell that has all the nutrients in it, and you keep it intact. Mm-hmm. If you take a grain like wheat grain and you take off the husk and the germ and you have a carbohydrate core and you pulverize it, well, that's flour.
Right.
But that, by definition, is a highly processed food.
Exactly, because you don't have all the other parts of that cell
Right.
And that's have the nutrients.
That's what we eat. This is what we do, and that concept, I just have to let that sink in with people a little bit because, I want to make sure I'm not losing them.
Right.
The whole thing with lifestyle medicine is not to try to convince somebody to do something that they don't want to do, but rather give them an opportunity to know that there's another way than taking 12 medications.
Right. And then let's move on and talk about physical activity. It doesn't mean that you have to go run a marathon.
Right. Well, here again, it is a conversation that I'm having every day in my clinic, and it starts with assessing, what people's goals are and what their current, activity level is, and depending on where they're at. Putting together an exercise prescription that, as a starting point, we would say, you want to be moving your body for 30 minutes a day, 5 days a week. And this is a pretty standard recommendation. But if you're really trying to improve your cognitive function as you get older, you need to add some resistance training. And you need to develop some approach to balance and flexibility. So those are all things, it's a lot to talk about in a 30-minute appointment, right? Or 15-minute appointment. So it really, starts with what are, people's problems that they want to address.
Yeah. Okay. I wanted to tell a quick story, too. Sometimes I have patients that do not exercise, that don't like exercise. They are incredibly sedentary, and I can talk them into getting a pair of walking shoes and putting them on every day. And that's their movement. And, then they come back and they say, I had my shoes on, so I just went for a walk. I
have to remember that one. It's about being creative.
Yes.
In that idea of meeting people where they're at.
Right.
This is not prescriptive, but any kind of movement, and if people are developing some type of, I call it SMART goals, right? Specific and measurable. What I warn people about is don't walk out of here with this idea that you're going to try harder. Walk out of here with a written idea of what that specifically means. What does SMART mean? Specific, measurable. It means it's actionable. You can actually do this, and realistic and timely. So they might walk out with this idea that they're going to put their shoes on and walk down the hallway, 5 days a week. Yeah. I mean, it could be that simple. But I'm always amazed at how people come back and they say, hey, I feel better.
Yes.
When you move your body, you feel better. And then there are those who, if they're not getting their exercise or workout in, it's kind of like an addiction. They go through a little bit of withdrawal.
Yeah. And you said something, those words, try harder. I try harder. It almost raises my cortisol to hear that. It stresses me out. So what about try something different?
Well, it's so funny because we were not trained in how to help people improve their lifestyles in medical school, right?
Not at all.
I would say the first 15 years of my practice, I was fine with people going and leaving the office and saying, well, I'm going to try harder. I'm like, good, you try harder.
Yeah.
And yet the training that we did recognized that that you really do need to be creative with each individual and be very, very specific on that. So to your point of, being creative, doing something different. But it all starts with the patient, because lifestyle medicine is different than the way I practiced in allopathic medicine for my whole career, right? Now it's a new compact.
Right.
If people want to have a lifestyle medicine approach to, improving their health, they have to take a lot more of the responsibility. And I'm becoming their coach then.
Yes. Yes, exactly.
And that is not how we practice medicine today in big box health systems. And I hate using that term, but in a sense, I look around at my colleagues and I'm like, someday you get it. Someday you'll do what I do because it's the right thing to do.
Right.
Just not today.
You'll do it differently someday.
Yeah.
So quickly, let's talk about sleep. Restorative sleep. What does restorative sleep look like?
Well, there's so much research just in the last 10 years on sleep. When we talk about restorative sleep, it depends on how nerdy you want to get, right? The glial cells in your brain are only activated during deep, stage 4 sleep. You go through cycles every night. You don't just go to sleep and wake up in the morning. You go through different levels of sleep, 4 different levels: REM sleep and stage 4 restorative deep sleep. And it's those deep sleep cycles that activate the scavengers in your brain called glial cells that take out the oxidative stressors and the all the toxins that you need to kind of get rid of, and that's why maybe it's become like the mechanism for why sleep is so important for every aspect of your health. You have one poor night's sleep, and your insulin resistance goes up. Your ability to function is reduced. And there's all the things that are just part of our daily routine that interfere with a good restorative sleep, not to mention, our cell phones and our blue light exposure in the evening. So our society, with just the amount of sort of emphasis or de-emphasis on stress reduction, is putting up all kinds of barriers towards good restorative sleep. And health really, it's a magical thing. Health really starts with a good night's sleep. Yeah.
So avoiding blue light, any screen, like a couple hours before bed, having your stomach empty, so not eating anything 2 to 3 hours before bed, dimming the lights in the room, doing gentle activities. It really changes the body and the brain for sleep.
And it's not really, people talk about just normal things like having a nightcap, right? An alcoholic beverage before you go to bed.
True.
Well, that disrupts your sleep cycle.
Yep.
And eating carbs right before bed raises your core body temperature by 0.5 degree or more, and that will disrupt your sleep. I've got probably 15% of my patients, I've estimated, have a bowl of ice cream at 8 o'clock at night.
Oh my gosh.
And, that's kind of the worst time to eat, and it's the worst time to eat the worst foods. So for all the reasons. Yeah.
Do they give up their ice cream? How hard is that? I'm curious.
Most of them will come back and say, yeah, I've cut way back, and they're not going to tell me that they actually haven't changed because they don't want to disappoint the doctor.
They're trying hard.
It becomes such almost a cultural thing. Okay, yes. They reach for that freezer and they're going after that bowl of ice cream. It's such a pattern.
And let's talk quickly about stress management. What does stress management look like?
Well, this is the hardest thing for a lifestyle medicine practitioner in an allopathic setting. Allopathic, Beth, is the traditional approach, to internal medicine. We have typically 15 minutes with a patient, maybe half an hour. But what we know is that this idea of stress affects your hormones, your cortisol level, affects your immune system.
Yep.
And your immune system is really monitoring your thoughts and your emotional status. I would say that's the one area that I am not happy with how I'm able to help with my patients, because I send people for counseling. We always do a GAD, generalized anxiety disorder, questionnaire. We do a PHQ-9 to assess for depression. That's part of our routine. But then when it comes to having options for them, again, it becomes, really individualized to, how we can approach it. I will say to people that some of their symptoms are most likely, related to their ability or inability to deal with the stress. But I can't start with that, because they oftentimes, and many of the patients that I see, stress and the emotional component is such a big part of their chief complaint, their fatigue, right? Their inability to sleep. It is so pervasive, but I can't start with that, because it seems like there's a block. If I just start with saying, well, this is stress, and they'll think that I just blew it off for them. Yeah. So it's one of those scenarios where you have to gain trust, and you have to work through it, and sometimes you have to rule out some bad things, and then you come back to it.
Yeah, one of the lectures that was at the recent functional medicine meeting was a lecture on joy and how to create joy and how to find joy in every day. And I'm thinking maybe instead of reducing stress, helping people find joy moments.
Well, one of the exercises that I have people to do every morning is to start with, what are the things that you're feeling gratitude for? And it does reset the brain's brain chemistry when you spend 15 minutes or 10 minutes just literally writing it down. What are the things that you have gratitude for?
Yeah, exactly. And then why? If you can ask why, write down why. That takes it another step deeper.
Oh, yeah. So in an ideal world, you set up a lifestyle medicine practice where you have a collaborative approach with the right kinds of integrated behavioral health counselors and coaches. And I don't have that. So I always have to, choose how I spend my time. Yeah. And I'm usually behind because of that.
Yeah. You have your nurse practitioners. So
I do have my nurse practitioners, and they are really amazing.
That's great. So let's put rubber to the road, and I am curious. Are there any stories you can share from your practice?
Well, I have a couple in mind. Okay. Recently, and the reason this particular patient comes to mind is because he and I graduated from high school the same year. So we're roughly the same age. Actually, he was about a year behind. He was also a swimmer, a competitive swimmer. So he was a very, very accomplished, athlete. And now I'm seeing him at age 63, and He has gained weight. He works in a sales office, and part of the culture in that office apparently is always bringing in the donuts. He's single. His wife died a number of years ago, but he has developed diabetes, and unfortunately, he's developed the complications of diabetes, which is, in his case, a pretty severe neuropathy. So it keeps him up at night. And he's been under the care of a endocrinologist, and they've been working with him to try to, get his blood sugars under control. But his glycohemoglobin has never been below 9 or 10 in the last several years.
Wow,
and they
that's
going
usually
up.
Around 5, right? That's the percentage.
Right. 5.6 is considered upper limit of normal. 6.5 is the cutoff for diabetes. And so this is, poorly controlled diabetes.
Right.
And they have gone up and up and up on the insulin. And it doesn't seem to be getting things under control. So we had a long conversation. This was a 75-minute, visit, which was, I don't have 75-minute visits.
Everybody was waiting.
But my patients sort of know this, that once in a while it's going to be their turn.
Yes.
And he left that visit, thinking and believing that there is another way. So it was basically we put together an intensive lifestyle medicine prescription for him. But the focus area wasn't on sleep because he's on CPAP and he sleeps okay. It wasn't on stress because he doesn't describe a lot of stress. And it really wasn't on exercise because there's not much he can do because his legs hurt so bad. It was primarily around nutrition. And so what we basically described was that, there are the do's and the don'ts. And I have this as a handout for people who want to go in that direction. It's literally 8 different do's and don'ts. The first one is do not consume sugar in any form. And he was a soda drinker. He loves his donuts. And this is just one of those things you just got to rip the Band-Aid off and get over the sweet addiction.
Yeah.
So that's number 1. Number 2, you need to then become, you need to add fiber. And I put it in those terms because if you're going to start with a whole food, plant-based approach, there's a connotation to that with some people like, I'm not just going to become a lettuce eater rabbit,
Right.
So I put it in terms of fiber because that way you're also addressing some of the really powerful effects of a whole food plant-based diet, which is, on your microbiome.
Right.
So I aim for 35 grams, although it's going to take a while to get that. So it'll be, if you're going to have breakfast, it's going to be steel-cut oats with a tablespoon of ground flax. I mean, we get pretty specific here. You can add some berries and some walnuts. And then lunch is going to be a salad. You sprinkle on some chickpeas or other legume, black beans. Add some avocado, which is, a high-fiber type of low-carb type of fruit. Yes. And then for dinner, it's going to be a roasted vegetable and 3 ounces of your choice of meat. And so I'm pretty prescriptive of what that looks like for people. And this is radical. For him, this is how I eat, by the way. But for this patient, this was a radical kind of change. And, and yet he comes back then a week later, and now he's hypoglycemic. He's getting low blood sugar reactions all the time. Right. And we're doing these virtual visits, and over the course of the next 3 weeks, we stayed in close contact and cut his insulin from 200 units a day down to 50 units a day. And we tried to go lower. His blood sugar started to go up, but his weight came down within, I believe, about a month, 22 pounds.
Whoa.
And what's important is that he's got hope, and he feels his energy levels, just rose. And the interesting thing is, his colleagues at his workplace decided that they would join him in his quest, and they stopped buying donuts every day.
So beautiful. Love that. Yes.
So, we'll see how this all goes, but he's already really seeing the impact of this. And this is just, we call it lifestyle medicine. You could you could say it's a change in diet, but now he wants to start swimming again, and he feels like he's good enough to get in the water and do that.
That is great. So, it brings tears to my eyes, really.
Well, he is an inspiration, and I have these classes, and as we've talked a few times, I don't have the ability time-wise in the type of practice that I have here to spend the time with the patients that I want to. So I have these once a month. I have classes at noon and at 5:30 on a second Wednesday of every month, and we do deep dive into sleep, exercise. It's always a conversation around nutrition, and I have somebody that has a story to tell and how they did that. So this particular patient is willing to come in and tell the story, which is also motivational for others who are just starting that journey.
Yes, and it's that connection.
Yeah,
he and his colleagues at work, he and the patients in the clinic. It's all connection. So after such a beautiful story, I want to ask you another question.
Mm-hmm.
Do you have any pushback from your colleagues or the administration because you're doing something different?
As long as my metrics are being maintained, meaning that I have enough productivity and my quality metrics are being achieved, administration is just allowing me to practice this. Mm-hmm. My colleagues, it's all over the board. Some of them are, curious, and I've invited them to come to our sessions, our classes. Mm-hmm. We've had one nurse practitioner do that. Mm-hmm. I think if there's comments about it, they're not sharing it directly with me. It's probably amongst themselves. Mm-hmm. But I know that I'm measuring insulin levels on all of my patients. I want to understand their metabolic health, their insulin resistance. That's a core type of practice change. And when patients are then seen by my colleagues, if I'm out of town or whatever, they get a different kind of practice. It's not just, they can't just pick up where I left off with a conversation around, their metabolic health. So it's a bit of an issue, and my nurse practitioners and I, we really do want to make sure that we're socializing our successes with our colleagues a little bit, and I'm starting to see a little bit more openness to that.
That's great. That's really nice to hear.
But I think it's early, and it shouldn't be. I think this is really how medicine should be practiced. Beth, I could tell you a little bit of story about how I kind of got into the lifestyle medicine in a bigger way. If you wanted,
I'd love to.
So in the 90s, the Human Genome Project was occurring, and myself and my colleagues, we would talk about it a little bit, thinking, okay, as soon as we understand all of the genetics of the human, we'll be able to prescribe and put together treatment plans that are individualized to that person's genetic makeup. Mm-hmm. And so the promise, was this new era. People would walk around with their genomic card on them. So here's my genes, and and that would happen maybe 20 years down the line after all this was done. This was completed in 2003. Mm-hmm. So we thought by 2020, we'd be there. Well, what happened? So what we found was jaw-dropping, was that, only 2% of, the DNA, there's 3.1 billion base pairs in the human genome, and this seemed like a big number, but only 2% of that is coding for a protein or an enzyme that is what makes us human. Right. The rest of it was just, it wasn't clear. So, it was thought to be, is that junk? Yeah. Well, now we know that it's not junk. A lot of that is part of what we call their epigenetics. Mm-hmm. And it's the way I look at it is, and I'm not a geneticist, but the way I look at it is this is part of the genome that's constantly monitoring your environment and your life experiences, and it's methylating certain areas. It's enhancing the, certain genomic expressions, and it's suppressing others. So it's constantly adapting you as an organism to your environment. Mm-hmm. Well, what we then saw in twin studies way back in 2005, there was one particular study that we learned about in ACLM is that 70 to 80% of the of a person's traits and their development of heart disease and diabetes is not based on their genes, but based on their environment or their lifestyle. Mm-hmm. So this is where the 6 pillars of lifestyle medicine fit in perfectly to that. It's addressing the epigenetic, the epigenetics that we as humans all have. Mm-hmm. Your thoughts, your emotion, your sleep, your toxic exposures, all of those things will determine how, you as an organism, as a human, live on this planet. Mm-hmm. Mm-hmm. And it's much more important. So I kind of got into the whole idea of lifestyle medicine through the, the All of Us program, which I was helping to promote. All of Us, I don't know have you ever heard of that, Beth?
I have not.
Okay. The All of Us program came out of the work of the Human Genome Project when it became clear that even that 2% of DNA that's coding for things is just a puzzle without any type of a picture to use against that puzzle. It's not clear what genes were doing what. Mm-hmm. So All of Us is an NIH effort that started around 2017, I believe, to enroll 1 million people to then crack the code. So you'd see, you'd have access to their medical records, mm-hmm. and you'd correlate that with their genetics. Mm-hmm. But it's turning out that what's more important is the epigenetics.
Right.
Because the vast majority of all of our DNA is identical amongst all humans. Mm-hmm. So
yeah, all of the choices that we make, the things that we do day to day that turn on and off gene expression, yes.
Yeah.
Yeah.
So that's, I think, part of what made lifestyle medicine, at least for me, so relevant. Mm-hmm. Yeah.
Yeah, and it's so powerful, and I would love if anyone takes away one thing from this conversation is there is so much power in every decision we make every single day.
Oh, yeah. I totally agree with that. But I also want to be able to point out that, we fall into patterns, mm-hmm. like our practice of medicine today is really pharmaceutical based. Right. Right? Yeah. And we're not curing anything. We're controlling somebody's blood sugars, and we're controlling their blood pressures. But the common denominator around all of this is their, in many cases, is their metabolic health and the health of their energy production at a cellular level. Mm-hmm. their mitochondria. And and again, you address that through lifestyle medicine.
Yeah.
So that's a whole nother conversation, isn't it? The
Yeah.
the whole notion of metabolic health as a key driver of human health.
Yeah, and we will get there. Everyone stay tuned. We will get there. Yeah, so thank you, Greg. Is there anything else you'd like to add?
Well, I just really appreciate the opportunity to talk to you about this, and I'm excited. And I also absolutely agree with you. Again, the connections that we had formed between the different enrollees at the functional medicine conference was just amazing. So it's the right thing to do. It's the right thing for patients.
Yeah, it's the right thing for the world.
Yeah.
Thank you, Greg, for joining us.
You're welcome.
You are listening to Rooted in Healing, and we'll be right back after this break.
We'll be right back with more Rooted in Healing right after these commercial messages. And now, more Rooted in Healing with Dr. Beth Claxton.
Thank you for listening to Rooted in Healing. I'm Dr. Beth Claxton, your host. We heard today from Dr. Greg Blommel, who practices lifestyle medicine in his clinic in Wisconsin. And as you've learned today, lifestyle medicine is the root, the basics of leading a healthy lifestyle. Like, how did we all survive before the era of antibiotics and medications? Lifestyle medicine. And our next interview is going to be really fascinating with Renee Fitton, who will talk about the fasting mimicking diet. This diet is exploding with scientific research to help people heal from diabetes, to help with all kinds of physical ailments and conditions, as well as turn back the biological clock. You're listening to KAZM 106.5 FM and 780 AM, Mellow Mountain Radio. Until next time, keep finding and searching for that which makes you feel vibrant.
For more information on Dr. Beth Claxton, visit bethclaxtonmd.com.